Help is available.
Treatment works. Recovery is possible.
You know, the field started with people in recovery who were providing what we would now call more or less peer supports. I mean, that's really what started. And we've now, the profession, we have professionalized, we've set standards that, didn't exist when we first started. And now we're going to be using a lot more peer support professionals, peer recovery coaches and things like that. And I think, to me, what's critically important is, number one, there are changes in how the services are going to be delivered. There's going to be a lot more push for integrated services and integration of care.
We're trying to look at the way behavioral health fits into the larger community wellness, prevention, health care, and health rehabilitation activities, and making sure that behavioral health is considered just like any other disorder. So addiction, mental illness, that they're treated, they're screened for, that they're addressed, referrals are made, brief interventions are done, and actual treatment is provided.
So over the years, our science has really evolved to really understand and help actually personalize the approach to dealing with the very unique and individual concerns that people have dealing with and struggling with addiction issues.
Education has been extremely important for the practice of addictions counseling because it is the requisite knowledge of the profession.
Like certification became a big deal, and working on a national certification system with research behind it, to now setting college standards, what you need to know at the college level so that you're being educated today with the skills that you need today.
NACOA sees itself as the voice for these children who are voiceless in their families and in society. And we develop and have developed over many years programs that don't just look at the treatment field and don't just approach treatment people, but we work with prevention specialists, with programs that are trying to reach out to at-risk children to prevent alcohol and drug use, actually, but the most at-risk children are the children who live in addicted families.
In the recovery movement, it's starting to become a much broader view of what treatment and recovery should look like, and I think that includes services of other young people who are in recovery coming in and speaking and sharing their story.
For the past 25 years, we've seen an explosion of community support, policy reform, and community activism trying to get more recovery high schools opened. Because what we know today is that 80% of our high school students that go into treatment, if they're returned back to their school of origin, relapse, and they're not successfully hanging on to their recovery.
What's changing is that it's okay to talk about addiction now. That's a direct result of people being willing to demonstrate their recovery and to be out front with the illness.
We've embraced the notion of a recovery-oriented system of care, which takes into consideration screening, brief intervention, referral to treatment, formal treatment, and then the resources that are necessary to help facilitate recovery. We see it as a part of a continuum.
I mean, it's so much easier to just kind of tweet a message out there about recovery, or put something on Facebook, or have, something right there so that folks know immediately what's happening. And I think that has been really advantageous to us growing our movement, because it's a lot quicker, we're able to reach a lot more people. And I just think that's been a great way to grow our movement.
It started out as Treatment Works Month, and then it went to National Alcohol and Drug Addiction Recovery Month, and now we see it in its current iteration as National Recovery Month. And so throughout those years, what you have seen is an engagement of hundreds of people that have become planning partners. Its evolution has not only engaged the recovery community, but the individuals that are serving the recovery community in a great partnership to bring the messages down at a community level.
The Entertainment Industries Council is really an outreach component that helps get the message out about addiction and recovery, and does it through a multitude of media outreach. First is our PRISM show, which is addressing the accurate and authentic depiction of mental health and substance abuse within the entertainment programming.
I play music, other people write books, other people write stories, but I think the essential piece to this is it's all based on a true story. And I know when I watch a movie, I sit down, my wife and I watch a movie, it says based on a true story, I'm immediately locked in because I know that this is a real event.
So our outreach is to take the good works of the entertainment industry that address these issues and then provide it to the public through television and through EIC Network TV, which is an internet-based television network.
I've had a front row seat to alcoholism and mental health issues and drug abuse, all that. So these stories come from true stories, you know, and the songs come from there. And personally for me, the songs are almost like prayers.
I'm Michael Botticelli. I'm the Director of National Drug Control Policy. The Obama administration has advanced a balanced public health and public safety approach to substance use disorders. We have seen significant progress nationally in moving to a chronic care model to treat substance use disorders, a model that encompasses prevention, early intervention, treatment, and recovery.